Hi, I'm Dr. Christopher Hamad. I'd like to share insights from our recent study titled Comparing the In Vitro Efficacy of Commonly Used Surgical Irrigants for the Treatment of Implant-Associated Infections.
What led you to do this research?
Our surgeons frequently manage complex revision cases, many involving infections of prior instrumentation. We noticed that irrigant selection during debridement often varied, driven more by habit than strong evidence. To clarify this, we asked a basic question. Do these irrigants have true antimicrobial efficacy? And if so, which are the most effective? We primarily focused on Staph aureus, the most common postoperative infectious pathogen, and tested against both planktonic and biofilm states to reflect the actual microbial environment of the wound bed.
What unanticipated problems came up, and how did you deal with them?
We initially tried using a small animal model of implant infection, but it proved challenging to deliver consistent irrigant volumes or reliably measure antimicrobial efficacy. We pivoted to a well-controlled in vitro model using titanium Kirschner wires, which allowed us to isolate and compare each irrigant's potency without the confounding effects of host tissue.
What findings surprised you?
One thing that stood out was how differently povidone iodine performed depending on the bacterial state. It worked well against biofilm, but not nearly as well on planktonic bacteria. That was surprising, especially since it's commonly used in a dilute form as prophylaxis, when bacteria are likely still planktonic. This raises questions about its routine use in prophylaxis. Even more striking, only the combination of povidone iodine and hydrogen peroxide was able to completely eradicate both staph and candida, even in polymicrobial biofilms.
Should practitioners change their practice based on your findings?
Not yet, but we hope our findings prompt surgeons to reconsider and reflect on their current irrigation practices. The povidone iodine and hydrogen peroxide mix is a low-cost, easy to mix, and had the broadest antimicrobial activity in our tests. It's a strong candidate for further study, especially in complex infections.
What remains the most important question unanswered by your study, and how do you hope to address it?
The big unknown is how these irrigants behave in real wounds. Do they get deactivated by tissue or fluids? Do they slow down healing or harm host cells? We're planning to test the povidone iodine and hydrogen peroxide combo in animal models next to study tissue toxicity, dwell times, and healing outcomes. Our end goal is to identify an irrigation strategy that maximizes antimicrobial efficacy without compromising tissue healing or patient outcomes. Thanks for watching, and thank you to JBJS for the opportunity to share our work.